Lieutenant Governor Josh Green just finished isolating after coming down with COVID. We spoke with him again today about the president's diagnosis and treatment. And with an election just a month away, how might this impact the race for the White House? Nikki Schenfeld follows up.
74-year-old President Trump falls under that high-risk category when it comes to COVID-19. Lieutenant Governor Green says the fact that he's headed to a medical center already is concerning. President Trump is seeking medical treatment just hours after testing positive for COVID-19.
My guess is they wanted to start treatment on the president very early before his symptoms got severe, but his category of risk is extremely high.
He says the mortality rate jumps to 10% for someone Trump's age. He says the president also has underlying health issues. Trump's doctor sent out a memo saying the president received a promising experimental drug to treat COVID on Friday. The president has been given zinc, vitamin D, famotidine, melatonin, and daily aspirin, but Green says the best prevention to COVID is wearing a mask.
Mask wearing can decrease transmission by more than 95%.
Green says Trump was likely infectious on Wednesday, and the entire House and Senate should be tested.
So they should shut down the House and the Senate immediately for 2 weeks if there's been a lot of close contact. And that, of course, affects government and operations and everything. So Washington could very well go into lockdown for a period of time.
Green says Trump should spend the next 20 days recovering, which would be 13 days shy of Election Day.
It's hard to ignore the irony that the president did in front of the nation belittle Joe Biden for wearing a mask too much.
HPU professor John Hart says the president will undoubtedly receive the best medical care.
I presume he will recover. I presume that he will then say, look, I'm in the high-risk group. I got over it, no big deal. On the other hand, if he goes on a ventilator, all bets are off.
He says it's too early to tell when the next debate will be, depending on how President Trump feels. But if the president recovers quickly, COVID-19 will be at the center of future debates.
I'm not sure how many undecided voters we have left in this situation. So it will be interesting to see. Again, the variable is, where does this go?
Nikki Schenfeld, KHON2 News, working for Hawaii.